Well, hello again from San Antonio. We're here at the STS meeting, and I'm Emily Farkas on behalf of CTSNet, and we're pleased to be able to speak with Dr. Okereke, who is the Vice Chairman of the Department of Surgery and the Division Chief at Henry Ford Health in Detroit, Michigan. Great to have you.
Thanks a lot, Emily.
So we heard a really compelling presentation that you gave this morning that was about trying to attract high school students into our field as a way to address the disparity in representation, not only in our field, but in other areas of medicine. Could you tell us a little bit about that effort?
Yeah, so I grew up in Detroit and I was very anxious to come back home, and one of the things which really has stuck with me is the unfairness and the lack of opportunity that some people in our society face versus others. So one of the things I thought I could do starting 8 years ago was to start a high school mentorship program. And a lot of this was very much word of mouth initially. I made phone calls to an assistant vice principal, and it was a teacher who owed somebody money, who blah, blah, blah. But eventually I was able to start with one high school, and 8 years later it's 16 high schools, thousands of students.
It's fantastic, and you have a lot of really fascinating data surrounding that. But so tell us a little bit about the program, how children get involved and how you engage them, and what the flow looks like in the
So I
program.
have now divided in 3 phases. Phase 1, myself or other surgeons go to talk to the school. We go there during some science class, second hour, etc. Phase 2, we bring students in on Saturday mornings for about 16 Saturdays a year into our surgical simulation center, our microanatomy lab. And then phase 3, it's a paid summer internship. Selected students are paid about $1,000 each, and they are paired one-on-one with a cardiothoracic surgeon, if that's their interest, a vascular surgeon, or OBGYN, etc.
It's such an interesting way to make use of a simulation lab or that kind of those materials. So these students who enroll, the 16 Saturdays per year, that's the same group? They're coming in a recurrent fashion? Or
different groups who come. We try to get as many students, and we have hundreds of students a year who come now. So we try to get students in at least once, and then some students, if they're interested, come multiple times. And what is interesting, you really hit the nail on the head. High school students are very much visual learners, and so they really like the interface of the minimally invasive work we do, the surgical stills. They find they're very, very good. If you want to talk about specifics, most of them have very strong contralateral hands, I think, compared to at least me when I was their age.
And so you find that by sort of illuminating their knowledge of their dexterity or their ability to see in 3D or whatever skill set that you uncover, that they are then more inclined to pursue a career in medicine, perhaps.
One of the questions we ask is pre and post intervention. What is your confidence in becoming a surgeon? And there's a statistically significant increase in that question.
And there was a really fascinating number. You tell me, long-term for students who had been enrolled for several years, there was like a 75% chance that they were they were actually pursuing a medical career.
Yeah, which is very heartening to us, because one of the things we wanted to do recently, we did this over the last few weeks and we're doing it now. Does this program work? Do we have any evaluation? And so we reached out to every phase 3 intern, and of those that responded, 75% are still on a track to be in medicine, anywhere from high school to residency.
That's really amazing.
Yeah,
and so
it's a lot of fun.
Is there like a parallel program for all STEM fields, or this is just a medicine targeted kind of platform?
So in fact, when we introduce the students, phase 1 and phase 2, mostly surgery. For phase 3, I tell them anything you want to be. I've had students who have been paired with judges, been paired with media, NPR for one of the students. In fact, most students think anything but surgery is cool, but the ones who go into surgery like surgery. But no, I want to, because unfortunately when we talk about disparities in this country, it's in blank and fill in the blank. So I think that if our program can help get more people in the legal field and more people in communication and marketing, then that's useful in that sense too.
We talked this morning a little bit about how it's so easy for us to identify disparities in 2024, but we're not maybe doing a good job of moving the needle and making a difference or being intentional about how we solve that. So it sounds like you were intentional about how you wanted to contribute to this.
I think especially as surgeons, one of the gratifying things is in the operating room, we're fixing something, we're revascularizing something, we're taking something bad out. I've always wanted to move from the talking about phase to the doing phase. And so being a part of an intervention is just a lot more satisfying. And I think you're right, moves the needle, even if it's slow.
Sure. And so how many people alongside you have you engaged, like your colleagues or your partners or people that you've also brought along?
This very much used to be a one-man show, and I found very early that there are strengths that other people have in the world that I do not have. So now there are about 10 to 12 of us who are very much involved, and they're all smarter than me in pretty much everything, but maybe a couple of things. And so they have really, you talk about how we do this, they have really expanded our grassroots efforts, and they're able to contact multiple different schools. We have the media team involved so that we can promote and raise awareness to the program. Yeah, absolutely. I'm the smallest piece of this now. It's really everyone else who's really just taken this to a new level.
How rewarding that must be for you.
Absolutely. Yeah, to see where we started in 2016 to where we are now, it really is a lot of fun, and I think the future is bright to grow it even more.
And it just probably passes on, propagates in the high school because friends hear friends doing something like this and they want to get involved too,
Yeah,
maybe
exactly.
in the coming
so we
years.
see a lot of the applicants do come from that, from peer-to-peer
Sure.
awareness, but then also to your point, I've seen other institutions now do similar things
Okay.
Across the country, and that's just nice to see, because that's really what we want to scale it
Sure.
on a major level.
And how would you recommend that any of our colleagues here at STS, if they wanted to start something similar, where would you suggest they start?
I'm sure they could contact us. I think I try to stress that what we do in Detroit is probably different than what I did in Galveston, is different than Indianapolis and Seattle, New York, etc. I think that if I provide them with a basic curriculum or how-to, they can look at that as a template and then maybe modify it as it were, as it fits for Indianapolis versus Detroit, as I said. So I think we can provide a basic roadmap, and then from there, it's not hard, it's not splitting the atom. You're not discovering the double helix. It's just a question of, are you willing to spend the time and you're willing to engage with the students? That's one of the things I'll say. It's not necessarily the means that's important. It's just showing the students who may not have had a lot of people believe in them, that they believe, that you believe in them. They see how good they are. They believe in themselves, and then really the rest is.
It probably makes a difference in so many ways that you can't measure, right? But are there other metrics that you're thinking of looking at in the future for this program?
Yeah, so to that end, as I said, there are a lot of things I do very poorly, and one of them is probably behavior epidemiology, but at one of our local universities, we've teamed up with some of the PhDs and some of the professionals to try to evaluate in better aspects what are some of the metrics we should be looking at. And not only for the student, if we affect 2 or 3 students at a high school, does that permeate throughout the entire high school? Should we look at things like unexcused absences, suspensions, GPA, number of students at a particular high school who go to college? So the answer is yes, and a lot of it's well above my head, but we'll hopefully expand the evaluation process.
It's so exciting the way you must be affecting these students' lives, not only professionally, but personally. And so what a meaningful difference, and what a nice initiative for you to just kind of go after.
Yeah, I say whatever I do for them, they do for me tenfold, because it is incredibly gratifying. And that's really should be all of our missions, to make the world better for the next generation.
It is always a bi-directional exchange, I think.
Absolutely.
It's been great to talk to you. Thanks so much.
Thanks a lot, Emily.
Thanks.